Hi, my name is Raniyah Copeland, and I am the president and CEO of the Black Youth Institute. On behalf of our board of directors, our staff, and the clients we serve, thank you all so much for being here. The third episode of The Black or the Plan, Our People, Our Problem, Our Solution. The Black AIDS Institute is the only national HIV and AIDS think and do tank that focuses exclusively on Black people. Our mission is to end the AIDS epidemic, and we do that by engaging Black institutions and individuals to confront HIV. We do training and capacity building with health departments and healthcare organizations and community-based organizations. We do mobilization and advocacy across the country. We provide information dissemination to Black communities, and we provide direct HIV testing, linkage to services to over 3,000 Black people in Los Angeles every year. All the work we do is from a uniquely and unapologetically Black point of view. Our motto speaks to our mission, which is our people, our problem. When we saw the emergence of COVID-19, we knew, particularly as a field that has fought an epidemic, that has fought a pandemic, that has disproportionately impacted Black communities, it was going to be really critical that we developed content for Black people by Black people to ensure that we had the information, the resources, and the tools to respond to the changing environment. We started off thinking about this series as it relates to COVID, and it quickly changed when we saw when we saw the uprisings that were happening across the country, and really this elevation of a conversation BAI and many others have been having for centuries around how systemic racism really drives inequity in Black communities. And if we're really to change racism, if we're really going to change the anti-Black racism that we as Black people experience, and the outcome, which is health disparities, poverty, police brutality, we had to have a different kind of conversation. And that is where we came up with this. We started with thinking about what is it that we need as Black people during this really traumatic time to ensure that our mental and emotional well-being was okay. We knew that we needed to make sure that our minds were right, that our hearts were right before we could tackle other issues. And that is what we focused on in the first episode. Last week, we started talking about and had an amazing conversation about change and advocacy. Once we kind of thought about the tools, we had discussions about the tools that we needed to make sure that our mental wellness was okay. We wanted to talk about how we can create real, lasting, and systemic change. And we had an amazing conversation about that. And we wanted to close out this series with really talking about the facts, right? What are the facts, particularly as it relates to COVID-19, that we are seeing across the country rises in cases. And as we enter 4th of July weekend, we wanted to make sure that Black folks had the facts around how we can protect ourselves this holiday weekend and how we can protect ourselves in a pandemic that we know is going to continue to evolve and change for the foreseeable future. And so we're really excited to have this series, to have this conversation in a way that only we as Black people can, in a way that centers and elevates what it looks like for Black folks to take care of Black folks. This is a long history that we have of supporting ourselves, of taking care of each other. And it's when we are leading efforts, when we're leading the change that we want to see in communities, that's when we've seen real and meaningful change. And so I'm very excited to be here today to have this conversation. I want to show gratitude and public acknowledgement and thanks of our sponsors for this series, Gilead Sciences. We're always grateful when we can show up in our true selves and our uniquely and unapologetically Black selves, and organizations can sign on to support that effort. We have two amazing and dynamic panelists for today's conversation. The first person I'm excited to introduce is Dr. Patrice. She's a psychiatrist, she's a public health advocate, and the immediate past president of the American Medical Association. She was the 174th president of the American Medical Association, or AMA, and is the organization's first Black woman to hold this. Dr. Harris has a diverse experience as a private practicing physician, a public health administrator, a patient advocate, and medical society lobbyist. Dr. Harris continues in private practice and currently consults with both public and private organizations on health service diverse delivery and emerging trends in practice of health policy. He is an adjunct professor, adjunct assistant professor in the Emory Department of Psychiatry and Behavioral Sciences, and an adjunct clinical assistant professor in psychiatry and behavioral sciences at Morehouse School of Medicine. Dr. Harris, I'm so grateful to have you, particularly with the Black Girl Magic, the two in the medical field. So thank you so much for being here today.
Well, thank you so much for having me. It's a pleasure and an honor to participate in tonight's discussion.
Awesome, awesome. We also have Dr. Stefan Wallace. He is a research epidemiologist, a thought leader, a public speaker, and public health and business consultant. He is the HVPN, or HIV Vaccine Trials Network, and COVID Prevention Trials Network Director of External Relations. He's also a clinical assistant professor in the Department of Global Health at the University of Washington. Dr. Wallace is an expert in developing, implementing, and evaluating major public health and human service programs in the area of HIV and AIDS, STD prevention, care and treatment, and related social service in diverse populations. Dr. Wallace's research commitment, inquiry, and interest at the intersection of public health and social justice, particular and intentional focus on the increasing positive outcomes of racial, ethnic, gender, and sexual minorities, U.S. and international, as well as HIV prevention, focused on key populations, men. Dr. Wallace, we're so excited to have you. I was teasing you when we were speaking that if it wasn't for COVID, I know you'd be on somebody's plane at some clinical site across the world. So we're really happy to have you here today.
Thank you so much, Raniyah. Thank you to the organizers and partners who helped to bring this together. I'm looking forward to the conversation as well. And this is an honor for sure.
Awesome. So, I wanted to kind of start with kind of where we're at, right? We are months into COVID now. I think that we've seen some drastic changes since February or March. And around March is when we started to see, April, we started to see states shutting down, closing down businesses, closing down economy to really kind of stop the spread of COVID. And here we are 3+ months later, and many things have evolved. And it's interesting to see really kind of across the field that we see states now that are shutting down again, and states that are reporting their highest number of COVID cases over the past 3+ months in the past week or two. So we see COVID increasing across the country. Dr. Harris, I'd love to start with you. What do you think the most important things that Black Americans need to know about the virus are and its transmission, particularly as we head into a holiday weekend, as we're in summer? What are the things that Black folks need to know? What are the things that we need to make sure our aunties know, our uncles know, our family, the folks that we love, we care about, and our own selves? So what do we need to know as it relates to COVID and the transmission of COVID?
Well, first of all, I love the title of tonight's webinar. It is all about the facts. And, I said I spent the first couple of weeks of this pandemic really not as my role as president of the AMA, I was at the time, but really as a family member and friend. Because I'm sure both of you and Dr. Wallace is probably getting all kinds of emails and calls saying, we're good. Black people are good, right? We can't get COVID-19. And so I spent the first couple of weeks sort of dispelling all those myths and rumors. And so it's important that we continue to make sure we have the facts. And I think, I get up every morning because the numbers, the data can be overwhelming, but I get up every morning and I center myself on the numbers and where we are and the facts and the data. And then think about what are some action steps that I can take individually and that I can make sure others take. January 21st, we had our first confirmed case. By March, it was in all 50 states. And then as the pandemic evolved, we saw hotspots, and candidly, they were on the coast, right? For the most part, although there were some untold stories, and we might get into this a little later. Like, for instance, at one point in St. John the Baptist Parish in Louisiana, they had a higher per capita number than even New York. But of course, we were focused certainly on New York, and certainly New York was hard hit. And so in some areas, we've seen a decrease in the number of cases, but as you note, at this point and going into this 4th of July weekend, we are seeing a patchwork of hotspots across this country in areas where I think folks perhaps opened up or loosened restrictions a little too prematurely. We are seeing increased number of cases, and by the way, this is important information. It is not just because we are testing more, right? It is because we have an increase in viral transmission. We are seeing in some of these areas, Texas, Arizona, Florida, an increase in the number of folks in hospitals. And we are seeing our colleagues across the country and in those areas worry about whether or not there will be enough hospital capacity. So right now, and I'm sure Dr. Wallace will talk about the future of treatments and vaccines, but as of today, June 30th, 2020, we do not have a vaccine and we do not have a treatment. We have some treatments that are working, for some in the hospital, but that's where we are today. And so but we are not helpless, right? We are not helpless against this virus. And so our best defense at this point is those basic tried and true public health measures: wearing a mask for yourself and for others, staying 6 feet apart in all settings. Of course, this is 4th of July weekend, and we can talk about this a little later. I'm not saying we all have to be indoors. Outdoors is safer than indoors. At this point, it is about risk and reducing our risk. And we are able to do some things safely. But again, wear a mask, stay 6 feet apart, and certainly use hand hygiene. So that's where we are today. And again, we're not helpless, but we really all have to commit to individual action so we can have collective impact.
Yeah, I think those are such great points. And I think today, one of the things that I even personally struggle with, and this is somebody who has, thousands of dollars in debt and student loans. So I feel like I should be a very strong public health expert. But, how do we assess risk as Black folks, right? That since March, I think, and now that we're in summer months, and we're seeing that COVID is going to be a reality for our life in the long term, how do we assess and mitigate risk? How do we determine who we let into our inner circle? Who do we kind of go back to? Should I be safe, and should I think about age, right? So should I not go to my grandmother's house because of her age? Should I not think about going to my parents' house because it's an intergenerational home? And when we have these intergenerational homes, we have various kind of age levels. And so there's risk levels that are different, right? So we have elders who are in their 60s and 70s. We have young people who are 15, 16, and are going out in the world and really kind of struggling with being at home. I'm interested in, and Dr. Wallace, please chime in if you have thoughts, but how can we as Black people think about risk as it relates to COVID-19? And what are some factors that we should weigh in decision-making for our family members and for ourselves?
So I'll just say a couple of things, and then of course, Dr. Wallace. So as I look at risk, I think of it as concentric circles of risk, right? And so we should be looking at our own individual risk. And we know that if we have a comorbid condition, if we have hypertension, if we have diabetes, if we have a disease that reduces or lowers our immune system, our body's ability to respond to an infection, we are at greater risk. Then we want to assess the risk of our close family members and friends. And so who we will be around, who we come into contact. Are they essential workers, right? Are they or our family members and friends? And we all know that Black people were disproportionately impacted, again, by health inequities pre-COVID, and of course that is holding true during COVID. And so we want to look at the community risk. Again, well, we're individual, then family, right? Who is around us? Perhaps a family member is an essential worker, didn't have the privilege of staying home, and so was greater exposed. And so we have to factor that in. Then it's our community risk. Certainly, if you live in Arizona right now or in Georgia where I live, but you even want to make sure, and this is where you hold your public health officials accountable, and I can say this because I'm a former public health county director, but know the risk in your surrounding community, right? I live in Atlanta. It's okay for me to know the broader Georgia statistics, but I need to know my community. So it's individual, then it's family, and then it is community. And then you start to look at activities. Inside versus outside. Certainly outside activities are better. Will I be able to maintain 6 feet, at least 6 feet of distance in anyone that I'm nearby? And so you factor in all of those, and then you make a determination. Look, and here's one thing we have to say, there is no such thing as zero risk, right? But it's a matter of your risk tolerance and who is at risk. And it's also a matter of decision making. I have been exquisitely careful because I have not been able to see my 86-year-old dad who has hypertension. And he lives in a senior apartment complex. And so everyone there is elderly. And I am paying particular attention and making decisions about my risk of spread to my father. So you, again, that's that family risk of those who are around you. And so you factor in all of those, and then you make a decision as to whether or not you will engage in a particular activity. But it's not that we have to stay cloistered, right? But we do want to make sure that we are assessing risks.
Yeah, I think that's wonderful kind of context, and thinking about how we can have these conversations with our loved ones and our family members, I think can also help model how we can have conversations about risk and how we can make decisions for ourselves and for our loved ones. So thank you so much for that. Since the emergence of COVID, we have seen an abundance of public health terms related to epidemics and pandemics. We have, a history of what happens when viruses like COVID enter into community or enters the world, and what that looks like for years to come. We've seen, a lot of conversation around flattening the curve, right? That's a phrase that we've heard consistently through media. We have heard about waves of virus, right? That it's expected that the virus, is going to kind of go up and down, up and down, up and down with new cases. We've heard of concepts like herd immunity. So I'm interested, Dr. Wallace, I'd love to hear from you. Dr. Harris, I would love to hear from you as well. What do you think that we can expect from COVID based off of past experiences that we have, particularly in the public health world, what we know of viral pandemics such as COVID?
There's so many, and thank you for that. There's so many intersecting aspects of this to me. When I think about the complexity of the questions that you just asked, what comes to mind immediately for me is sort of trust, public trust in health authorities, public trust in the medical institution, public trust in doctors and physicians, and even the government. There are quite a few conspiracy theories out there surrounding COVID, as I'm sure you both are aware. And a lot of this wraps around to this idea that this isn't real, that somehow this has been engineered, it's been made up, and it's not real. It's not really impacting people in this way. And this is, a tool of the system in order to, eliminate and wipe out Black folks. What I can say is that racism and white supremacy operate with precision. And if there was a tool or a design in order to wipe out Black folks in this country, we would have already experienced it. I will also add that I think it's really important that we contextualize, that we think about as Black people, how we engage in these conversations about diseases and epidemics and all of these things. Understanding that historical abuses against Black people have happened. Tuskegee is one of those situations, but that's just one of many. There have been many, right? And so thinking about what these situations mean in the context of not just what happened historically, and what didn't happen historically, right? But also thinking about the evolution of those situations and what we have now. As an example, we have institutional review boards and federal oversight rules and regulations regarding clinical research that we didn't have 50 years ago. And that these systems and this infrastructure is in place in part as a direct response to some of the historical abuses that people are often citing. And so there are pieces in place to help protect this process. The other thing is that I think it's important that we arm ourselves with, and again, appreciating Dr. Harris's comment, I appreciate that this is focused on facts. We can't spend our time and our energy and our wheels focusing on misinformation and focusing on the rumor mill. It's important to understand that there are people, Black people, who have dedicated their lives to the medical, to addressing medical inequities, to addressing health inequities in our communities. And it's important that we understand what these things mean for us and our lived experiences. And to your point about flattening the curve, and there's a whole lot of other places that I can go with that, but I'm trying to be succinct. To your point about flattening the curve, this is really about the capacity and the infrastructure of our medical systems. We live in what people would say is arguably the most privileged and the most well-resourced country on the planet. However, we also have one of the most fragile medical systems in the world. And so when we think about medical capacity and flattening the curve, it's really about how many resources, how many beds, how much equipment, how many staff, how many personnel, what is the infrastructure of the actual hospitals and clinics that could respond to pandemics in our communities? And are they resourced in a way that would support an increase in cases? And in many instances, we see that they're not well resourced to respond to these pandemics. And so flattening the curve is really about helping to ensure that we don't overload our medical systems with so many cases that we end up in a situation like Italy, where they had to make very complicated, and I can say and describe this in so many other ways, but they had to make decisions, essentially, about who would live and who would die, about who would be able to get on the ventilator, about who would have access to the beds and the equipment in order to help save their lives, because they saw so many cases that it overloaded the healthcare system. So flattening the curve is really a response in order to help us ensure that we don't hit that capacity, so that people who actually need life-saving equipment and services are able to get it.
Thank you for that. Dr. Harris, I would love to hear from you. What do you think that we can expect based off of historical experience for coronavirus? How long is it going to last for? I know some of the kind of answers to this, but I think that, and I know that some of these answers are really hard because we don't have the answers. But kind of what we know from previous viral pandemics. What can we expect from coronavirus based off of those previous experiences that we've had?
Well, I wish I knew the answer to that question. And I think that is something that we should point out about this particular virus. The official name is a SARS-CoV-2, right? And by the way, COVID-19, because we should name and identify these viruses appropriately and not use any terms that are derogatory to any one ethnic group. But this is a novel, new coronavirus, right? What does that mean? That means that coronaviruses are not new, right? There's a family of viruses, many families of viruses. Coronavirus is one family. Many of these members of the coronavirus family cause the common cold. This particular coronavirus is new. And that actually is one of the reasons it's so challenging. We don't know a lot about this particular coronavirus, but there are, as you know, a lot of things that we do know. Now, although it's June now typically, and I'm curious to hear what Dr. Wallace thinks about this. If this coronavirus behaved, because we are in the middle of, early summer now, like other coronaviruses, there was a possibility that we would see a decrease in the summer months, right? Because that typically happens. But this coronavirus thus far, technically, we're early into summer, just June 21st. But so far, as you stated early on, we are seeing an increase in cases. Now, we are seeing an increase in cases because we've seen certain behaviors, right? Folks, again, I think we relax too soon. And by the way, I want to say it's not only when we relax, it's what we relax. And that can inform us going forward. Here in Georgia, the businesses that opened first were barbershops and hair salons and nail salons, and I'm all for that, hair and nails, right? I'm all for that. But we actually needed to be, and the guidance from the administration's task force said this, we needed to be thoughtful. And what happened was we opened bars and a lot of high touch establishments where there was a easy opportunity for closeness, right? And the inability to maintain appropriate distance. So I think right now we are seeing the results of that. Just everyone should know that the statistics today are really a reflection of what happened 2 to 4 weeks ago, right? So we should look at what we were doing. So whatever you were doing 2 to 4 weeks ago, whatever was going on in the community 2 to 4 weeks ago is a reflection of what's happening now, which again, in some ways is hopeful because it means that we are not hopeless and what we do now can determine our future. So it's very complicated and it's too soon to tell if there will be a decrease, but certainly there's so much intersection because it is about it's about the virus. The virus is still here, but it's also about our behaviors. And the worry is even if it does decrease during the summer months as we go through the rest of the summer, it may increase again during the fall when we may have an increase in flu cases. So I think the answer, and I know it's not very satisfying, but is we don't know, we can't predict, but we are not helpless and we can act now to decrease our risk and the risk of others. I did want to say a word about trust. First of all, I appreciate seeing Dr. Wallace. Because I know that there's a history of mistrust, and there's Tuskegee, and there's Henrietta Lacks, and it's very important to see Black people who are leaders in research and clinical trials. And I know Dr. Wallace knows this, but I would say, and I'm a part of the medical establishment, if you will, I'm part of the medical ecosystem, but I don't expect people to just trust me, right? And just because I'm Black, just trust me. I expect people to say, Dr. Harris, I want you to earn my trust. And I think we should do that. And one way to do that, and this is a broader question, is to go into communities and, again, show people like Dr. Wallace is working on research and clinical trials, and ask the community, what do we need to do to earn your trust so that you are willing to participate in these trials? Because participating in these trials is very important. It means we have data on Black people, right? And that is so important. We know, again, that this so far is disproportionately affecting Black people for many reasons. Comorbid conditions, essential workers, 401 years of institutional racism and slavery and Jim Crow, discriminatory housing, all of those issues But moving forward, again, we are not helpless. We do need to earn trust and participate in the solution.
I appreciate.
Thank you. Yeah.
I appreciate. I just want to chime in really quick. I think that one, I appreciate you saying that, and I absolutely agree. I think part of building that trust is partnering with communities. I think that there's a relationship and a power dynamic that exists in the way in which clinical trials and the medical institution sort of operates. It's a power position, right? And so thinking about how communities can, how institutions can support autonomy and agency in communities, and recognizing the assets and the strengths that communities already have, including our communities and especially our communities. And then working with communities in research, and not, we have a motto in the HVTN, the HIV Vaccine Trials Network, and that is that we don't do research on communities, we do it with communities. And part of that partnership and relationship is demonstrative in the way that we are structured as an organization, as well as the way in which we involve communities throughout the entire research process. And I think that's where we need to be, and where we need to be moving toward when we think about building trust. And you're right, it's sort of going into communities and establishing that trust, and ensuring that we're bringing them along in the process. And we're not just inviting people to take part in studies, but we're also bringing them along in the process so that they understand what it is that we're doing and the why. And giving communities an opportunity to provide feedback and critique the research and to critique the process, I think, is also very important.
That's wonderful. When we thought about this episode, we said facts only, right? What are the facts? What are the details, information that we have to have? And I think because of, like you said, Dr. Harris, we don't know what's going to happen. Based off of what we know from other coronaviruses that we live with on a regular and a daily basis, we can expect that this novel coronavirus is going to be here for some period of time. And one of our best solutions for eliminating coronavirus, or this strain of coronavirus, this new coronavirus, is through vaccines. We thought about vaccines, clinical research. That's a big conversation to have in Black communities. Can we do this here? But we thought that we had to at least talk about kind of like, what are the facts as it relates to these clinical trials that are happening in the U.S., that are kind of coming down the pipe. And so, Dr. Wallace, I'd love to hear from you about kind of like, what are the facts? What does COVID vaccine research look like? What's happening? And what you can tell us about the details of what's happening in our communities right now as it relates to clinical research for COVID. And I think I'd be remiss if I didn't also say that, we have had within the HIV field, the HIV Vaccine Trials Network for a long period of time. And that network that Dr. Wallace, you've been a part of and instrumental in, was tapped into to lead COVID vaccine trials because of the way that the HIV movement has engaged, and really HIV advocates and communities have led clinical research. That really we've seen from HIV, the way when community is centered, when community is advocating for these advanced biomedical tools to be responsive to viruses, the change that we have, the way the community is engaged is completely different and hugely beneficial. And so I'm interested, Dr. Wallace, in what's happening with COVID vaccine research right now across the U.S., what we should know as Black folks, and the facts about how this is rolling out.
Sure. And I'll try to be succinct. There are quite a few studies that are coming down the pike within the COVID prevention network. And these studies are vaccine in nature as well as antibody studies. There are also studies that industry sponsors, pharmaceutical companies, are running separately. So there are a couple of different pathways in which research is happening around this particular virus. So I just want to sort of contextualize that. So for the studies that are specifically happening with the COVID prevention network, you're right, Raniyah. I think the HVTN is involved. There are other partners involved, the HIV Prevention Trials Network, the AIDS Clinical Trials Group, and some other groups. And really there is a lot of strength and I think experience, expertise with respect to engaging communities, centering community voices, and ensuring that communities are represented in the process, right? So that we're not replicating any of the previous issues that we've described in this discussion so far. So part of these studies are going to be looking at different vaccine candidates. You know, each of the industry sponsors that we're working with is going to present a different vaccine candidate. So in terms of what folks need to look for, I think it's important that folks understand, one, that there are going to be different vaccines that are going to be researched, and that there are different ways in which these vaccines will work in order to potentially disrupt the process or the sort of the replication process that the virus takes on. We're also going to be testing antibodies specifically, and I can go into a whole spiel about passive immunity. But the other thing that I wanted to sort of talk about is the IRB process, the institutional review process, the ethics committee review processes, and that there are groups who are specifically tasked with looking out for the interest of participants in these clinical trials. And having a conversation with, you know, anyone who's at a clinical trial site, you know, get your questions answered, find out all of the information, talk to other physicians, talk to other folks in the community about what this means. At the end of the day, as you so articulated, I don't believe that we're going to be able to eliminate COVID-19 or reduce the impact of this in our communities without a vaccine strategy. And so I think it's important that we engage in this conversation, and that we think about how this looks for our lives. Part of the reason why I'm involved in vaccine research personally is because I understand that there are implications for Black folks not being involved in vaccine research. You know, you don't know whether a vaccine will work across all different kinds of people unless all different kinds of people are included in the research. The other thing that I want to say, so that it's crystal clear here as well, since I know there's a captive audience, is that there are no research trials that are happening within the COVID prevention network that are explicitly focusing on Black people. There are no trials that we are running that are only focused on Black people. That is not the goal. As I mentioned a moment ago, we need to test the vaccine on different types of folks, different groups of people. So the people we're looking to enroll come across in different ethnic racial groups, as well as people who have different kinds of exposures to COVID, you know, people who work in different occupations who might put them at increased risk for acquiring SARS-CoV-2. So I think that we need to really sort of think about this conversation as well.
Thank you so much for that. You know, I think, especially since we see clinical trials rolling out right now, that it's really important that Black folks have the information about these trials so that we can make sure that we have informed decisions, and that we have all the information we need to decide if this is something that we should be participating in, that our family should be participating in, and that Black people we are smart, we are resilient, we know how to survive and to thrive, and ensuring that we have the information to do that is critically important. So I'm happy to hear about that, Dr. Wallace, and we'll make sure that we also kind of link people to information related to this so they can get more information to have conversations within their family. You know, you spoke, Dr. Wallace, about immunity, and I want to bring it back to Dr. Harris. Can you talk to us a bit about the basics of the immune system within the context of COVID-19? You know, is it possible to be immune or build immunity to COVID-19? Are there ways that we can boost our immune system so that we can fight COVID-19 within our immune system? How does immunity play a role in relation to COVID?
Well, you know, we are still in the midst of a lot of clinical trials. And by the way, the one thing that we always have to focus on with COVID or with any disease is the science and the evidence and the facts. Now, because this is a pandemic and everyone is so anxious to have a vaccine or to have a treatment, or you hear them called therapeutics, there's, you know, the first trial or any positive results, even if it's in 5 people, 5 people were helped by X, that's in the news and it's in media. And so we have to be careful. So need everyone to know, just like the vaccine trials will go on and they will be well researched, any treatments are. And so right now there's just no specific, I hear people talking about vitamin D and zinc and all these other things, and really isn't. So, there are some general ways that we can stay healthy, right? That are true now and they were true before. We need to eat as healthily as we can, right? We know that, and that helps our immune system. We can exercise, right? And, move, stay in motion. That actually helps our physical health. It helps our mental health. And again, it doesn't mean you have to have this exercise routine that's very involved. It's just getting out and walking. Or if you don't have a safe neighborhood, I say put on your favorite, artists and dance around your home. So that helps. Getting enough sleep and rest, which, by the way, these are all challenges right now. But those are the best ways, that we can overall boost our immune systems. And again, there is no one magic immune boosting pill, unless Dr. Wallace may tell me there's one, but latest I looked at the research, there isn't. I wish there was. But there isn't. And so those are just some basic things. Now, of course, I'm eating not as healthily as I normally would. And so certainly a multivitamin is just a good adjunct, because we don't always get the vegetables and, and all that we need. But those are just some basics. But that's what we need to do to stay healthy and boost our immune system, no matter what.
Yeah, we talked a little bit about this in the first episode, because, we talked about drinking water and, how we overall keep our immune system up to help, in general, stay healthy is even more important right now. I want to say that I'm so grateful for the both of you all. I wish I had more time now. 45 minutes is not enough. There are so many more facts that I want us to talk through. So we'll have to figure out, how we can continue this. I think that being able to have conversations among the most talented, insightful, educated, experienced Black folks is such an empowering thing. It's such an empowering activity during these times. And so I'm so grateful for you, Dr. Harris, for spending time with us. Dr. Wallace, thank you so much for joining us for this episode that really was about facts only, how to survive and how to thrive. What are the facts about acquisition, transmission for COVID? So thank you all so much for joining us. To our audience, again, for joining us for this virtual speaker series. Black AIDS Institute constantly strives to ensure that we are disseminating information in a way that allows Black people to know about the tools that we need to not just survive, but to thrive, that we as a community are well equipped to take care of ourselves. We as a community have taken care of ourselves for centuries, taken care of others for centuries. And during this time, that we have to make sure that we have all the information that we need to support ourselves and to support our families. I want to encourage you all to follow us on social media at Black AIDS. We'll be doing an after show on social media where we will be bringing some of our BAI staff and experts to have conversation around the content today, answer questions you all may have. So please make sure you go to our social media at Black AIDS to find out more about us. And you can go to blackaids.org to find out more about Black AIDS Institute. Thank you for the support that you guys have given us, the donations that we've received to really ensure and empower our mission to end the Black AIDS epidemic by engaging Black institutions and individuals to confront HIV. I think there's no doubt more than ever that making sure that we have a uniquely and unapologetically Black lens on everything that we do is critically important to having the success that we need to thrive as a community. After each of these virtual speaker series, we wanted to make sure that you left with amazing kind of material and resources. And, if we were in person, we would want to give y'all some amazing swag goodie bags. And so we have virtual goodie bags that you will see in your email inbox tomorrow. We have cocoa floss which is a luxury floss subscription service. So please kind of you can see that. We have Purple Carrot, a company that produces plant-based meal prep ingredients, and then Seed, a company that develops clinically studied probiotics to impact human and planetary health. You'll also be receiving in the next few weeks, we've partnered with Beam, which is an amazing mental health organization founded by and for Black communities to develop, and we'll be sending you guys a Keeping It Real toolkit so that we can make sure that these conversations that we're having, this information that we are having is going to continue to grow, that you have tools that you can have these conversations with community members, with your families, with your friends and folks that you love. We are a continued resource for this effort. Black AIDS Institute is here until there are not racial disparities anymore. That ending health inequities is critically important to us. Health justice is racial justice. So thank you guys for participating with us. Thank you for listening and sharing, and we look forward to seeing you on social media, seeing you on our website in our efforts to make sure that Black communities are thriving during this time. Thank you all.